to identify problems and suggest solutions. It gives us the hope of a better system tomorrow. For those of us who've had loved ones or have been themselves in the system, we know we need a better tomorrow. With that said, I couldn't be more pleased today than to introduce Parliamentary Assistant to the Minister of Health and Long-Term Care, Robin Martin, and Ontario's Attorney General and Minister for Francophone Affairs, the Honourable Caroline Mulroney. Parliamentary Assistant Martin is here with the Attorney General to make an announcement on behalf of the Honourable Christine Elliott, who was unfortunately not able to attend because of an injury. Since coming into office nearly a year ago, these two women have been working tirelessly for the people of Ontario. Their government set out an ambitious mandate last year, and I know that myself and all our members were thrilled to see that investing in addiction and mental health services in this province has become a top priority for this government. The Ontario government has committed to invest $3.8 billion over the next 10 years on addiction and mental health care. And the recent Ontario budget started to reveal the details of the investments with an initial down payment of $174 million for addiction and mental health services this year, largely in community-based services. I know all of our members are looking forward to hearing about your plan to invest in community-based addiction and mental health services to help reduce wait times, improve access to addiction and treatment services, increase access to supportive housing, and expand capacity for children and youth services. So before I introduce you formally, I also want to thank my colleagues Kim Moran from Children's Mental Health Ontario and Camille Cannaville from Canadian Mental Health Association Ontario Division for being here with us today. Robin Martin is the Member of Provincial Parliament for Eglinton Lawrence, a riding in which she has lived and been active for over 20 years. In addition to her role as MPP, she serves as Parliamentary Assistant to the Minister of Health and Long-Term Care and is a member of the Standing Committee on Social Policy. Robin has also served on the Select Committee on Financial Transparency. Robin holds a Bachelor of Laws from the University of Toronto. Prior to that, she earned her Bachelor of Arts and Master of Arts from McGill University, studying overseas for a year at the l'Institut d'études politiques in Paris as part of her master's program. She practiced litigation for over a decade at Osler and Lexner. She has also worked as a policy advisor for the Ontario Ministry of Health. At a personal level, Robin has been married for 28 years to her high school sweetheart, John Martin, and has a son and a daughter. The Honourable Caroline Mulroney, Attorney General and Minister of Francophone Affairs, is also here. Minister Mulroney was first elected as the Member of Provincial Parliament for York Simcoe in 2018. Before entering politics, the Minister had a successful career in the private sector, spanning business and law, while effectively running a charity benefiting homeless and at-risk women. She previously served as Vice President of Bloomberg Sen Investment Partners, a Toronto-based investment firm where she managed client services, marketing, and business development. Prior to that, the Minister spearheaded corporate and regulatory matters related to growth opportunities in Canada and the United States for Wellington Financial LP. Please join me in a very warm welcome for PA Robin Martin and the Attorney General, Caroline Mulroney.
Good morning, everyone. Thank you, Adrian, for your kind words. And I should just start by saying yesterday, as you may have heard, Minister Elliott slipped and fell while she was grocery shopping. She went to Toronto Western Hospital where she received some stitches for a minor head wound. But I want to assure everyone here and all Ontarians that following routine tests, doctors have determined that there are no concerns with Minister Elliott's health. And they've asked simply that she stay home and recover for a few days, which I hope she will do. I know that Minister Elliott is extremely disappointed to not be able to be with you here today. but I'm very honored to be here in her place. Many of you may not know this, but mental health and addictions is one of the reasons Minister Elliott actually made the decision to enter public life. For 10 years, she sat on the board of the Durham Mental Health Services. And as part of her work with that organization, she saw firsthand the gaps in care, the struggles Ontarians faced in trying to navigate a complex system. So she made the decision to roll up her sleeves and get to work. And I'm sure at that time she had no idea that it would take quite this long. But over a decade later, she couldn't be prouder to be leading our government's work to strengthen Ontario's mental health and addiction system. Indeed, as many of you have heard by now, we have some very exciting news to share. And really, there isn't a better place to do that than among all of you, the people on the front lines of mental health and addictions and our mental health and addiction system. A few weeks ago, our government announced new annualized investments of $174 million in frontline mental health and addiction services. These investments target priority areas in desperate need of immediate action: community mental health and addiction services, earlier, faster mental health and addictions help at schools and in the community for youth and children, mobile crisis intervention teams that will help police officers and other first responders manage sensitive situations when assisting people with severe mental illness, supportive housing for Ontarians struggling with the dual challenge of homelessness and mental health and addictions, and many, many others. Critically, our government is investing in both mental health and addiction services. Because here's a simple truth, which I'm sure you all know. We can't begin to address the challenges presented by mental health without also tackling the challenges posed by addictions. And we certainly can't begin to solve the challenges of addictions without also tackling the challenges posed by mental health. We need to address them together. Ontarians need and deserve access to an integrated and connected system, a system that understands that these are complex issues that demand comprehensive solutions, including and especially the ability to effectively treat concurrent disorders. And that is why our government has weighted our investments toward community care. We need to build a future where the emergency room is one of the last options for someone in a crisis, not the only option. This year's investments, This year's investments, of course, are only the beginning. Our government, as you know, is committed to spend $3.8 billion over 10 years to develop and implement a comprehensive and connected mental health and addictions strategy. Which brings me to why we are here today. For several months, I had the pleasure of joining Minister Elliott as we traveled across the province to hear about the changes Ontarians expect to see in our province's mental health and addiction system. Together, we spoke to first responders, primary care providers, the frontline personnel in hospitals, community agencies, and we spoke with people with lived experience, families, and caregivers. We spoke to stakeholders from all regions of this province, from Toronto to Thunder Bay and Ottawa to Windsor. At every one of our 19 engagement sessions, we heard that patients and families are being left to navigate a confusing mental health and addiction system on their own. They're waiting too long to get the services they need. When they finally get to the front of the line, they often experience disconnected care. This is a system-wide challenge that has left many families with gaps in their treatment. And it's a challenge that amplifies someone's struggle with mental health and addiction. A challenge that Minister Elliott has been working to find solutions for since her time chairing the Select Committee on Mental Health and Addictions more than a decade ago. During our consultations, we also heard that simply putting more money into the mental health and addiction system is not enough. The system, we were told, needs a central engine to standardize and organize the sector. Making every dollar count in a system as complex as mental health and addictions requires data. It requires performance indicators and a common infrastructure to disseminate evidence and set service expectations. Most importantly, it requires a common approach to ensure that Ontarians know how to access services where and when they need it. Our government will create just this kind of a central engine that we heard that we need. This afternoon, we will introduce the Foundations for Promoting and Protecting Mental Health and Addictions Services Act. If passed, this act will establish a Mental Health and Addictions Centre of Excellence within Ontario Health. This new centre will lay the foundation our province needs to implement our mental health and addiction strategy and ensure Ontario patients and families are able to access integrated, evidence-based care and services no matter where they live. With the support of the Centre of Excellence, Ontario will finally be able to standardize the quality and delivery of mental health and addiction services across the province and help patients and families access better and more consistent patient services and supports. If passed, this act will finally deliver on a key recommendation from the 2010 Select Committee, the creation of a central engine responsible to the Ministry of Health and Long-Term Care to manage and coordinate Ontario's mental health and addictions services system, and to act as a provincial single point of oversight to ensure consistency in the delivery and quality of services across Ontario. For decades, other parts of our health system have benefited from provincial system engines. Cancer Care Ontario revolutionized our cancer care system in the 2000s. Health Quality Ontario drove a quality agenda for healthcare across primary care, home and community care, and long-term care. But there is no equivalent provincial cluster of expertise supporting the mental health and addiction system. With our Centre of Excellence within Ontario Health, that changes. The new centre would also provide support and resources to Ontario Health teams, our new model to integrate care and funding, connect patients to the different types of care that they need, and help navigate the system. While the Centre of Excellence will anchor our comprehensive mental health and addiction strategy, it won't solve all of the issues facing the sector, but it's a critical first step. So, while Minister Elliott spends the next few months finalizing our full-scale provincial strategy, Ontario Health, through the Centre of Excellence, will start to work to develop the capacity to ensure the sustained and effective implementation of our strategy. As we begin this important work, we will also be looking for new ways to work together with our community mental health partners like yourselves. Together, we need to streamline supports and provide better, connected, and comprehensive care to patients. Today's Act is part of our government's ongoing commitment to make mental health and addictions a priority. We are making changes to put people and families at the center of mental health and addictions care, so services are more inclusive and accessible for everyone. But the Mental Health and Addiction Centre of Excellence that I've just told you about is only one of two components in the Act. Working with Minister Mulroney, The Act, if passed, will help form a key element of Ontario's strategic response to the opioid crisis. Everyone here today knows all too well that opioid addiction is a complex and devastating illness. Indeed, all addictions are. Minister Mulroney will now share with you our government's action to protect our province's most vulnerable. Thank you.
Thank you, Parliamentary Assistant Martin, for sharing our government's commitment to addressing mental health and addictions with comprehensive solutions to these two complex and often concurrent issues. The Mental Health and Addiction Centre of Excellence within Ontario Health will lay the foundation the province needs to implement our mental health and addiction strategy. Le Centre d'excellence en santé mentale et traitement de dépendance de Santé Ontario servira de fondation nécessaire à la mise en œuvre de notre stratégie de santé mentale et de lutte contre les dépendances. Il assurera aux patients de l'Ontario et à leurs familles l'accès à des soins et services intégrés, fondés sur des données probantes, quel que soit l'endroit où ils vivent. En outre, il uniformisera la qualité et la prestation des services de santé mentale et de lutte contre les dépendances à l'échelle de la province. Our government was elected by the people of Ontario to protect what matters most in healthcare and education and to respect taxpayers. We are here today to move forward on our commitment to mental health while taking action to battle the ongoing opioid crisis and holding manufacturers and wholesalers accountable for their roles in the crisis. Ontario has witnessed a major increase in opioid-related deaths, hospitalizations, and emergency department visits over the last decade. In simple terms, it's a crisis. Nous vivons une crise. It is a crisis that has come with tremendous costs, both in terms of lives lost and the pressures it has put on our healthcare systems and on our communities. A variety of strategies are needed to respond to this crisis. Later today, the Ontario government will introduce the proposed Foundations for Promoting and Protecting Mental Health and Addiction Services Act 2019. Plus tard aujourd'hui, le gouvernement de l'Ontario présentera un projet de loi novateur. If passed, it will allow us to take further action to battle the ongoing opioid crisis and hold manufacturers and wholesalers accountable for their roles in this crisis. Si ce projet de loi est adopté, il nous permettra de prendre d'autres mesures pour lutter contre la crise des opioïdes qui est loin d'être terminée et de tenir les fabricants et les grossistes responsables du rôle qu'ils y jouent. The legislation would support Ontario's ability to sue opioid manufacturers and wholesalers for their alleged wrongdoing in order to recover past and future healthcare costs paid by Ontario taxpayers due to opioid-related disease, injury, or illness. We are a government committed to protecting what matters most and standing up for those on the front lines of our healthcare system and for patients who rely on them for healthcare. This includes frontline mental health services. This is why we intend to invest any proceeds awarded as a result of this litigation back into frontline mental health and addiction services. C'est pourquoi nous avons l'intention d'investir les montants obtenus dans le cadre de cette action dans des services de première ligne de santé mentale et de traitement des dépendances. This bill will create a series of special rules designed to facilitate the litigation process, and it would support Ontario's participation in the national class action lawsuit British Columbia launched last year against more than 40 opioid manufacturers and wholesalers on behalf of provincial, territorial, and federal governments. While we are pursuing this legal action in recognition of the disproportionate toll that opioid products have had on Ontario, we also recognize the terrible impacts other addictions are continuing to provide, we also recognize the terrible impacts of other addictions and are continuing to provide services across the province to help those in need. We are taking this action because Ontario's Government for the People is committed to ensuring that when people need help, the frontline services that they rely on are there for them and their families. We are protecting what matters most. Nous protégeons ce qui est le plus important. Merci. Thank you.
Thank you very much, Madam Attorney General and Parliamentary Assistant Robin Martin, for joining us today with this very welcome news. I think when we think about what's been done in other parts of